Dear students, welcome to YouTube portal of Department of Public Health Dentistry. Today we are going to discuss about the topic survey procedures in dentistry. Now coming to introduction, survey is a non-experimental type of research. It's mainly to gather information about the status of large number of people when describing about the present conditions without directly analyzing their process. It can also call as non-experimental investigation. Types of surveys are descriptive or analytical, cross-sectional and longitudinal. Uses of surveys are monitoring trends in oral health and disease, mainly for policy development, for program evaluation and assessment of dental needs, and providing visibility for dental issues. The next, methods of data collection. First one is health interview survey, face-to-face survey, then health examination survey, health record survey, then questionnaire survey. Questionnaire survey, we have face-to-face format, open-ended questions, closed-ended questions, Likert scale and Cutman scale. Then next, coming to steps in surveying, there are 7 steps. First step is establishing the objective. Second is designing the investigation. Third, selecting the sample. Fourth, conducting the examination. Fifth is analyzing the data. One is drawing the conclusion. Seventh one is publishing the results. Now we can see each steps in detail. The first step is establishing the objective. Your objective, it should be clear. It should be a null hypothesis. It should describe the situation and what is to be measured. The next one is designing the investigation. Here we have to follow some protocol for survey procedures. Then we have to fix some budgeting. Then we have to use some emergency care and referral. The next, methods of data collection. In methods of data collection, we have health interview survey, health examination survey, health record survey, and questionnaire survey. In questionnaire survey, we have mail questionnaires, telephone interviews, and face-to-face interviews. The next, third step is selecting the sample. For selecting the sample, we are using convenience sampling, random sampling, systematic sampling, stratified cluster random sampling, and multi-stage sampling. Next, the systematic sampling, we have to use the sample for every n numbers for systematic sampling. The next one is stratified sampling. Stratified sampling, here the population, it should be classified as subgroups or strata, and following the sample from each stratum are selected. For like example, like urban, rural, male, female, and based on age, we have to select the sample. The next one is multi-stage sampling. Multi-stage sampling means selected clusters should be included in the sample. This method is known as cluster sampling. Here, the groups, it can be designated as clusters. So, it's called as multi-stage cluster sampling. The next one is probability proportional to size sampling. In this sampling, the method of sample selection, the probability of persons being sampled is proportional to the number of persons within a particular group. It's called as probability proportional sampling. The next one is conducting the examinations. By conducting the examination, here we are using approval from authorities. We are using instruments and supplies, then infection control, analyzing the area, then training and calibrating the examiners and examiner area. For examiner area, it should be clean. It should be under natural light. Next one is method of examination. Here we are using type 4 examination, type 1, type 2 and type 3, type 4. Type 1, it means complete examination. Type 2 means the limited examination. Type 3 is inspection. Type 4 is screening. Then training and calibration. Training and calibration. Here intra-examiner and inter-examiner variability mainly to reproduce the same diagnosis of the same condition of another occasion. It's mainly measured using kappa statistics. The kappa statistics, it's mainly kappa statistics, it's a index is used to measure the agreement which may expected by a chance. The values would be, if it is +1 means it's a perfect agreement, 0 means no agreement, -1 means a complete disagreement. Next one is analyzing the data. Here, the analyzing the data, it should be manual, computerized. The tables and graphs should be presented. Next, drawing the conclusions. Interpretation of analyzed data is specifically related to the investigations. The results it should be based on your investigations. Next one is publishing the results. Publishing the results, first it should be statement and purpose of the survey, then materials and methods, results, discussions, conclusion, summary, and recommendations. These are the steps we are following in the steps in publishing the results. The 7 steps we are used in survey. Next one is in WHO oral health survey methods. We are using pilot survey and nation pathfinder survey. Pilot survey includes most important subgroups in the population. There are only 1 or 2 index age groups, usually 12 years and one other age group. The survey provides minimum amount of data needed to commence the planning. Next one is National Pathfinder Survey. This survey it mainly incorporates sufficient examination site. Here mainly to cover all important subgroups of the population. It may have differing disease levels or treatment needs. There are at least 3 of the age groups or index age groups. This type of survey design is mainly suitable for collection of data for planning and monitoring of services in all countries. The level of disease, availability of resources, or complexity of disease. Coming to basic oral health surveys, the survey is mainly to collect the basic information about oral disease status and treatment needs for planning or monitoring changes in disease levels. There are some objectives in basic oral health surveys. And the first objective is to mainly to provide a full picture of the oral health status, monitor the changes in oral health disease, some age-related disease. It will be irreversible, both past and present condition of the disease, and extensive documentation of different socio-economic conditions and environmental conditions are the main objectives of the basic oral health surveys. In basic oral health survey, we are using a 5 index age group. First one, 5 years, 12 years, 15 years, 35 to 44 years, and 65 to 74 years.
These 5 index age groups, why they have selected in WHO assessment form, we can see clearly. 5 years, mainly we are examined between 5th and 6th birthdays. The caries level, it should be primary dentition. The children, they are beginning their primary school. That's why they have selected at 5 years. For 12 years, they leave the primary school. Then all the permanent teeth will erupt except third molars. The 12 years is the global indicator age group. 15 years, mostly permanent teeth will be present with exposed for 3 to 9 years. The caries prevalence in adolescents, in 15 to 19 years, periodontal disease in adolescents can be seen. In 35 to 45 years, the oral health condition in adults can be seen. The full effect of dental caries, the level of severe periodontal involvement will be there, and the general effects of oral health care provided can be seen in this 35 to 44 years. In 65 to 74 years, it mainly to estimate the manifestation of oral disease from a life course perspective and mainly assessment of the ultimate effect of oral health programs in your population. These are the 5 index age group in WHO assessment form they have selected. Survey, it's a practical economic survey sampling methodology. Here stratified cluster sampling technique used. It includes most important subgroups of the population. In Pathfinder survey, we can use index age group. It will be a minimum expenses. In Pathfinder survey, there are 2 types, pilot survey and national survey. Pilot survey includes 1 to 2 index age group. It provides minimum amount of data. National survey, it covers all important subgroups. Minimum 3 index ages, it can be used in national Pathfinder survey. In the 2 types, in the pilot survey and national surveys, the difference in pilot survey, we are using only the most important subgroups in the population. In national survey, it includes sufficient examination site to cover the important subgroups of the population.
This age group is mainly we are using for the using for our surveys in WHO assessment forms. In WHO assessment form, we are using 2 assessment forms. One is 1997 and 2013 pro forma. Now we recently are using 2013 pro forma. Now summarize the topic. Today we have covered introduction about survey, types of survey, methods of examinations, Then steps in survey, what is pilot survey, national pathfinder survey, WHO assessment form, performance, and WHO performance and their objectives.